Hello, and welcome to a surgery coding review for our 2020 CPT code set. Today, we're going to focus on part of the 30,000 series with a focus on the respiratory system. So in your 2020 CPT book, you'll want to turn over to page 189. And from there, let's begin. So no matter what section or subsection you're working with in the CPT manual, it is critical that you understand the role that anatomy plays in the coding process. Speaking of anatomy, on page 189, you'll notice that from an anatomical perspective, the first part of the 30,000 series, which is the respiratory system, includes the nose, the accessory sinuses, the larynx, the trachea, and the bronchi, and then the lungs and the pleura. Each of these anatomical sites are further subdivided based upon the procedure types that are available. In some sections you have incision, in some sections you have excision, others you have destruction and repair. Then you also are going to have procedure code options for endoscopic procedures. And an endoscope is a device that's designed to look within a particular body part. And so the name of the endoscope is going to vary based upon the intended use of that particular scope. And so, for example, a scope that looks in the sinuses is called a sinoscope. The other thing that is very important to note is, given the fact that we have the different code options for the respiratory system procedures, when you're reading the operative note, you need to read through the report and determine, was this in fact a procedure that required a scope, or was this a procedure where it was open in nature or percutaneous in nature? All right, let's go and explore some of our codes. So we're going to start on page 191 with the anatomic site of nose. And under nose, we're going to look at incision. Now, what I want you to note here is that the first two codes say drainage, abscess, or hematoma. The first one, however, is nasal internal approach. The second code is nasal septum. So one word actually changes the code description. Then from there, we have our excision codes. And I want to look at a couple of the code families here, not all of them. So first I want to start with 30110 and 115, which are the codes for excision of nasal polyps. What you'll want to note here is the division of simple versus extensive, but also note that these codes are designed where it doesn't matter if it's, one polyp or 3 polyps. The code includes one or more polyps, and they're divided, again, simple versus extensive. Also take note of the use of modifier 50 when it applies. All right, so then after that, we're going to look at 30117, 30118. What I want you to notice here, it says incision or destruction, and it's an intranasal lesion, but we have one code for the internal approach, another code for the external approach. Next, drop down to 30130, which is for the excision of the inferior turbinate. I want you to note that if this procedure is done on the superior or middle turbinate, you're not going to use 30130. Rather, the parenthetical note tells us to use 30999. Immediately after that, you have another procedure on the inferior turbinate, but notice here, this is a submucous resection. There are some parenthetical notes to pay attention to. Then the last two codes, you have a rhinectomy, and notice that they're divided into partial or total. Also of note, in the case where there is a closure after the rhinectomy procedure, that is something that can be coded separately. One of the things you want to pay very close attention to, because this does change from code family to code family, is whether something is or is not separately reportable. So there's a couple of things I think is worth mentioning. Number one, each case has to be scrutinized on a case-by-case basis. Also, think NCCI. Is there an NCCI, National Correct Coding Initiative, edit that prohibits us from reporting two codes when only one is applicable? And if you're brand new to coding, it does take some time to learn all of these rules. So just take it one step at a time. All right. Next up, let's go and take a look at repair. And here, there are really three main code families that I want to focus on under repair. Those three code families are 30400, 30430, 30460. So the first thing I want to tackle is I want you to notice 30400 is a rhinoplasty primary. 30430 is rhinoplasty secondary. So as you know from medical terminology, rhinoplasty is the surgical repair of the nose, commonly known as a nose job. And primary is the first time that they're doing the procedure, whereas secondary is when the patient has already had this procedure done and they're having to do some type of minor revision, and that's why it's called secondary. And then 30460, what you'll notice here, this is a rhinoplasty for a patient that has a nasal deformity secondary to a congenital cleft lip and or palate. Major differentiation here, 30460 is for the tip only, whereas 30462 is for tip, septum, and osteotomies. Of note, when you're coding any operative report, the very first thing that you want to do is to understand what the doctor is doing and why they're doing it. So the what they're doing is the CPT code. The why is the diagnoses code. And if you research the procedures to learn more about them, research the condition to learn more about it, you'll really have a clear understanding of why the doctor is doing what they're doing today. All right, next up, we're going to go over to page 192. And on page 192, I want you to notice other procedures. And under other procedures, we want to take a look at control of nasal hemorrhage. So that's code family 30901, which is anterior, simple, 30903, anterior complex, and then the code for posterior is divided into two options, 30905, which is the initial procedure, posterior in nature, and then 30906 is our subsequent procedure. All right, next up, we're going to go to accessory sinuses, and this will take us over to page 193. And what we want to look at here are our sinusotomy procedures, and there's a lot of things going on here. So starting at 31020, this is your sinusotomy procedure, but it's maxillary and it's intranasal. So major differentiation here, 31020 intranasal. 31030 radical without removal of the polyps. 31032 radical with removal of the polyps. And note, in all cases, modifier 50 is to be utilized when applies. 31050, 31051 sinusotomy, but it's the sphenoid. 31070 is a sinusotomy, but it is frontal. Again, watch out for parenthetical notes. 31070 is actually a large family of codes. So you'll notice 31070 is external simple. And then as you go through the code family, the way that they do the procedure where changes. Again, whenever you code a new procedure for the first time, don't just read over the words and not understand what you are doing and where it is on the body part. Get a picture so you can actually see the difference between the frontal sinus, the sphenoid sinus. What role does that particular body part play? Then also on page 193, under excision, and still talking about the accessory sinuses, we want to look at ethmoidectomy. Ethmoidectomy, we have 3 codes in this family, and you'll notice the first code is intranasal anterior. The second code is intranasal total, and the third code is extranasal total. Again, anytime you see a word that you don't know what it means, be sure to look it up. All right, next up, we have our endoscopy codes, and we're starting with, because we're still in the sinuses, this is a endoscopy, a sinus endoscopy. And there's a couple of rules on page 193 that you'll want to take a look at. These are our subsection notes. And as a reminder, while you're learning to code real time, it's critical that you are actually looking at the subsection notes real time, reading through them, making notes where you need to, so that when it's time for you to prepare for your national exam, you would have already gone through them once, and the second time is just a review. One key note here, a surgical sinus endoscopy includes a sinusotomy and a diagnostic endoscopy. And there are some other notes that I know that you will read. On page 194, that's when we get into all the different types of sinusotomy procedures. It starts off with 31231, which is a diagnostic procedure. So there's a couple of diagnostic options. And then 31237, that's where you get into the surgical options. Now, something I want you to take note of, if you look on page 194, I want you to notice that the first code family, 31237, goes all the way down to 31243. And this is for nasal sinus endoscopy surgical. And it then is differentiated by with biopsy, with control of nasal hemorrhage, as well as some other procedures. Of note, watch out for your procedures that are known as separate procedure. If you've forgotten what the definition of a separate procedure is, I recommend that you go back to the section guidelines for surgery, and on page 72, you'll want to make note of separate procedure rules. All right, so then from there, the next code family, 31254, nasosinus endoscopy surgical with an ethmoidectomy. Now, do you remember we just saw an ethmoidectomy procedure that was on page 193, but the big difference here, there's a scope involved. And that's why I said it's important as you're reading the operative note to understand what's going on. I have personally found, because us coders, we're not physicians, I personally have found value in watching a YouTube video on the procedure itself, because then I have a full understanding of what I'm actually reading. So I'm doing more than just reading the words on the paper. I'm understanding what the doctor actually did. And that goes back to, if you learn about the condition and then you see the procedure that they're doing, you'll say, wow, that makes complete sense. So 31254 is where this code family begins, divided into partial, which is anterior, total, anterior, and posterior, and then different versions of the total procedure. So watch out for that. Lots of parenthetical notes. Pay attention to those. Then the next code family gets into nasal endoscopy surgical with maxillary enterostomy. That's 31256. And then after that, you have all different types of code families that identify different parts of the nasal sinus procedure. Again, take the time now to explore the code options that are available. All right, so next up, we're going to go on over to the larynx. That's our next anatomical site on page 196. And a couple of things you'll want to note here. Starts off with excision procedures. So for example, there is a laryngectomy, but then there's also a laryngectomy, and laryngectomy also has an option for a partial laryngectomy. So again, very important to know what's actually happening in the operative report before you go and pick up your codes. And then of course, we have laryngoscopy procedures on the bottom of page 196. And you want to read the operative note for these types of procedures to determine if an operating microscope or a telescope was used. That goes back to reading and understanding that operative report. You also want to make sure that you know if this is a diagnostic endoscopy or a surgical. Very important to note that surgical always includes the diagnostic procedure. So the diagnostic is them just putting the scope in, looking around. The minute that they take something out, move something around, it becomes a surgical procedure. Other terms to be familiar with as you're looking at the codes on 196, 197, the terms indirect versus direct. Indirect is using a laryngeal mirror as shown in the diagram here, whereas direct is when they are inserting the laryngoscope. Okay. That picture of the direct laryngoscope kind of reminds me of when you watch television shows and they are gonna do a procedure on a patient to open up their airway. You kind of see them doing something that looks similar to this. All right. Other terms to note as it relates to the type of scope, you may see the term flexible versus rigid, and those names are exactly as they sound. You know, something that's flexible has the ability to move, whereas rigid does not. So just a couple of, things to really pay close attention to. All right, next up, on to the trachea and bronchi. So we're over on page 198. And the first thing that we want to look at under incision are our tracheostomy codes. Major differentiation here. Was the tracheostomy planned or was it an emergency? Planned, we have codes 31600 through 31601, and emergency 31603 and 31605. You also want to take note of the approach that is done for the tracheostomy. Was it transtracheal or was it cricothyroid? Again, you're seeing these terminologies. Get a picture so you can visualize where is the cricothyroid. You also want to note that with the planned procedure, age is a factor in this particular code family. All right, next up, we want to go to bronchoscopy procedures. So now we're on page 109, and of course it starts off with lovely subsection notes that talk about things like a surgical bronchoscopy includes a diagnostic when it's performed by the same physician. Things that you want to pay close attention to here. There is a code option, the very first code option that is designed to capture when the patient has a tracheobronchoscopy through a tracheostomy. So remember the tracheostomy, that the codes that we just saw. So you want to look in the operative note to see if the scope was actually inserted via the tracheostomy site or if it was inserted through the mouth. And again, that documentation is going to spell that out for us. Now, here you'll notice 31622, they include the word rigid or flexible in the code description. The other thing to note is with regards to 31622 that fluoroscopic guidance is actually built into these codes and should not be coded separately. Of course, there are parenthetical notes that you'll want to pay attention to. And if you're looking on page 31622, you notice that that's when that code family begins. And as you start to look at all the codes that are indented, those are like the children codes, they're indented pretty much this whole family. So the standalone code 31622 goes all the way over to 31654 on page 201. So that just kind of lets you know, whoa, this is serious business here. So pay close attention. Next up, we're going to go to lungs and pleura, which start on the bottom of page 201 with some subsection notes that, yes, continue on page 202. Again, I do want to remind you that now is the time to read the subsection notes real time while you are learning coding. You don't want to put yourself in a situation where it's a month before your respective coding exam and now you're reading through these notes for the first time. All right, so starting on page 202, we have thoracostomy, O-S-T-O-M-Y, and thoracotomy. Big difference here. Ostomy means to create an artificial opening, whereas otomy means to make an incision. Now, one of the things I want you to notice with the codes on page 202 is that with these particular codes, the use of an endoscope here on page 202, 203 is not a factor. So that's something that's so important, again, throughout the surgery section, is to determine if a scope was actually utilized. All right. Next up, I want to look at pneumectomy code. So I'm on page 203 under removal. Okay. And under removal, I want you to notice the first code, removal of the lung, pneumectomy, which then splits off into two other options, 32442, 32445. Then you'll notice Over at 32480, you have removal of a lung other than pneumectomy. And here we're talking about lobes being removed. So this picture here actually gives you kind of a visual. So again, I cannot overemphasize the importance of looking at pictures to understand what you're actually coding. And so here, these codes on page 203 are divided based upon the extent of the lobes that are actually being removed. All right, next up, we want to look at Thoracentesis, and those codes are on page 204. And centesis, as you know, is a surgical puncture to remove fluid. So 32554, 555, this is removal of fluid or withdrawing of fluid from the pleural space, usually indicated for patients that have congestive heart failure or pneumonia. In these particular cases, the drainage tube may be left in place to continue draining of the fluid. And what you'll want to notice here with these two codes, they are divided based upon whether or not image guidance was used. So without followed by with. And then immediately after, notice that you have two more drainage codes here. And these are pleural drainage, percutaneous, with insertion of an indwelling catheter, and same division, guys, with and without imaging guidance. All right, so of course, this section would not be complete without having some endoscopic procedure codes, which takes us over to page 205, which is where we have our thoracoscopy codes. And these are called video-assisted thoracoscopic surgery procedure codes. Of course, the diagnostic is always included in the surgical. And what you want to watch out for here is just the wording of the codes. So 32601 is where we have our diagnostic thoracoscopy procedure codes. And then 32650 is where we have the surgical options. Here again, watch out for the indented codes. So the standalone code 32650 starts on page 205. And then if you look on page 206, you'll notice all of those codes are indented to the very end. Again, watch out for the parenthetical notes. Last code family that I want to look at here are the lung transplant codes. And one thing you'll want to note about lung transplantation codes is that, or just actually transplant codes in general, is that CPT is always going to tell us that for lung transplants, heart transplants, that there are what's known as 3 distinct components of the physician work. As it relates to the lung transplant, you have part 1, which is the cadaver donor pneumectomy. Part 2, for all of our transplant procedures, is going to be what's known as the backbench work. And then the third part is actually transplanting the organ into the recipient. All right, guys. Well, this has been your journey into the 30,000 series of the CPT Surgery Code Set 2020 version. I'm stopping right here on page 208, and I'll come back with another video where I'm going to look at the cardiovascular system, as well as the well, actually, I'll probably do a part 3. Depending on how long part 2 is, I can tell you that in previous years, my part 2 has been pretty long because cardiovascular is very, very complex in terms of surgery. And to prepare for that, what I ask that you do is review cardiac terminology and procedures relative to what you're coding. Don't try to do everything cardiovascular. Stay focused on what you're coding and learn that part. I'll see you real soon.